It's 2 a.m. Your emergency department is already busy when a patient arrives seeking help after a sexual assault. Do your medical personnel know how to provide appropriate care?
Hospitals with emergency departments have a legal duty to provide comprehensive sexual assault forensic medical examinations. Administrators have a responsibility to understand the requirements, implement proper protocols, and ensure emergency department medical personnel are educated on how to provide high-quality, victim-centered care every time a victim of sexual assault presents to the hospital. The following are key legal requirements hospital administrators and emergency department medical personnel should understand. If your facility provides emergency services, you must have policies in place to properly respond to patients who disclose sexual assault. This includes having a physician, sexual assault nurse examiner or SANE, or other qualified health professional such as an advanced practice registered nurse or nurse practitioner, or a physician's assistant, PA, available to offer a comprehensive sexual assault forensic medical examination 24 hours a day. This is first and foremost. Patients cannot be turned away because the facility doesn't have specially trained staff. Individuals cannot be refused a forensic exam because the emergency department doesn't believe the patient was assaulted. Individuals cannot be turned away because a nurse or doctor of a certain gender isn't available, or because the emergency department is swamped with other patients. Patients reporting rape or any other form of sexual assault cannot be turned away for any reason. Individuals cannot be denied care or access to evidence collection, period. Number 2. Hospitals must contact the local rape crisis center prior to beginning an exam in every case of sexual assault presenting to the emergency department, regardless of the age of the victim. This includes victims who did not want to report their assault to law enforcement. The patient may choose whether or not to have the advocate in the room with them for the exam once the advocate arrives. Number 3. The hospital must seek informed consent to perform a sexual assault forensic medical exam from the patient. Minors may consent to an exam without parental consent. If a medical guardian has been appointed, the guardian may consent on the patient's behalf. A physical examination may be conducted for basic treatment and to collect appropriate samples in all cases of sexual assault, regardless of the length of time that may have elapsed between the time of the assault and the examination itself. If the assault occurred within 96 hours of the forensic medical exam, the Kentucky State Police Sexual Assault Evidence Collection Kit for victims shall be used. Number 4. There is no law in Kentucky that requires all sexual assaults to be reported to law enforcement. In most cases, the patient has the right to decide whether or not to report. The exception to this would be the mandatory reporting of child abuse, neglect, or dependency. If the patient wishes to report, the hospital should notify law enforcement as soon as possible. Hospitals have a maximum of 24 hours to notify the appropriate law enforcement agency that the kit is ready for pickup once the patient consents. If the patient declines to report, the hospital must store the kit for a minimum of 1 year. Hospitals may destroy unreported kits after 1 year of storage. Number 5. The hospital must provide education regarding prophylaxis or treatment of sexually transmitted infections, including HIV, as well as information regarding emergency contraception. Current CDC guidelines and hospital policies should be reviewed. At the conclusion of the exam, a healthcare professional shall provide the victim with information regarding treatment follow-up. No charge shall be made to the victim for sexual assault examinations by any entity or individual. The hospital may bill the victim's public or private health insurance, and they should also give the patient information about the Crime Victims Compensation Board under the Kentucky Claims Commission and have them sign the appropriate CVCB form. It is important that hospital administrators and emergency department medical personnel understand these legal requirements. Hospitals should have protocols and procedures in place to ensure they are followed, and that medical personnel, including physicians and nurses who are contracted, are properly educated. Victims should never be turned away because emergency department personnel don't understand their legal obligations or do not feel comfortable providing the required care. The Kentucky Hospital Association has free posters available that highlight these requirements. We urge you to place these posters where caregivers can use them as quick reference guides.
Key legal requirements summary. Number 1. If your facility provides emergency services, you must provide comprehensive sexual assault forensic medical examinations. Number 2. The hospital must contact the local rape crisis center and request an advocate. Number 3. The hospital must seek consent from the patient to perform a sexual assault exam and collect evidence. Number 4. In most circumstances, the patient decides whether or not to report the assault to law enforcement. Number 5. The hospital must provide information regarding prophylaxis or treatment for sexually transmitted infections, including HIV, as well as information regarding emergency contraception and follow-up recommendations. Number 6. No charge shall be made to the victim for sexual assault examinations.
Imagine suffering the unimaginable, your body, mind, and soul violated, traumatized by another person, someone you knew, maybe even trusted, or perhaps it was a complete stranger. You may feel shock, confusion, fear, anger, shame, self-doubt, and even self-blame. Seeking help by going to a busy emergency department in the aftermath of this trauma can be overwhelming. Patients may fear being judged or not being believed. They may fear barriers to care, such as language and cultural differences. Their wounds and their emotional pain may not be visible, but they are excruciating. Examinations can be both physically and emotionally exhausting, but they also can be a positive step toward healing for the victim and an essential step for the criminal justice process.
Treating sexual assault patients also can be daunting for physicians and nurses. No two patients are the same. They may face complicating circumstances, such as intimate partner violence, drug and alcohol-facilitated sexual assault, and human trafficking. They represent vulnerable populations, including children, the elderly, immigrants, individuals with physical or cognitive disabilities, sex workers, and individuals with addiction. A large number of sexual assault patients do not sustain obvious injuries. Subtle injuries are patient and assault specific, and detection is dependent on examiner training and experience. It's important to remember that the absence of obvious injuries doesn't mean they weren't sexually assaulted. For any victim of sexual assault, the emotional and mental toll is high. A third of these patients develop post-traumatic stress disorder.
Imagine waiting for hours in a cold, sterile hospital room in soiled clothing or a thin hospital gown. You don't know what to expect during the exam, and you don't know the nurses or physician. You feel exposed, and you're worried about getting home to your child or getting to work. Maybe the medical staff offer you a blanket, a quiet room, and kind words. Or maybe they are abrupt and rushed, and you aren't sure if they believe you or even care. A poorly worded question makes you wonder if they think it's your fault, or you overhear them laughing or making an inappropriate comment outside the room. After the exam, you want to shower and you want clean clothes. You want to understand what's next in your long road to recovery.
Discussing the assault with medical professionals and undergoing a sexual assault forensic medical examination, also known as SAFE, is invasive, difficult, and time-consuming. That is why patient-centered, trauma-informed care is critical. Some do's and don'ts. Do move through the exam at patient's pace. Don't be perceived as being in a hurry or having other priorities. Do minimize loud noises, talking, and disruptions, and ensure their privacy, safety, and confidentiality. Don't require patients to repeatedly retell events. Do phrase questions and explanations in appropriate, non-judgmental ways. Don't express personal opinions. Physicians and nurses should understand that similar to providing care for patients that present complaining of a headache, Their primary purpose is not to try to prove the complaint is valid, but to provide an exam, support them, and provide the highest quality, patient-centered care possible.
Victims of sexual violence arrive in Kentucky emergency departments a number of different ways. Whether they are brought in by EMS or law enforcement, or they come by themselves or with a friend or relative, their first encounter can set the tone for what that victim may experience throughout the exam and possibly even the investigative process. Our words and actions are important. One of the hardest things about surviving an assault is the lack of control. When a patient discloses rape or sexual assault, it is critical that we allow them to regain some of that control by making choices regarding their care. Before beginning the exam and as required by law, ED staff should contact the local Rape Crisis Center to request an advocate. The advocates should be made available to the patients prior to beginning an exam when possible. The patient may decide not to have the advocate in the room. They may prefer a family member or friend, or they may want to have the exam done privately. It is important that the patient be given choices and that they understand their rights. In addition to the right to advocacy, patients should be aware of the resources available to them throughout the exam and criminal justice process. Kentucky Rape Crisis Center advocates understand the victim's rights and can be helpful not only in providing emotional support while they are in the hospital, but also in informing them about services available once they leave your facility. Once an advocate has been requested, the healthcare professional must determine if law enforcement should be notified of the assault. In most cases, this will be up to the patient. Kentucky law does not require that all sexual assaults be reported to law enforcement. If the patient is under the age of 18, ED staff should determine whether the mandatory reporting of child abuse, neglect, or dependency applies. If it does, the appropriate law enforcement agency and Child Protective Services worker are determined by the location at which the assault occurred. If mandatory reporting does not apply, law enforcement should only be notified with the consent of the patient. If the victim is unsure about notifying law enforcement, he or she must be given the option of proceeding with the forensic exam and allowing the hospital to maintain the evidence in a secure location for at least 1 year, or until a victim decides to report the assault to law enforcement. Prior to the exam, ED staff must obtain informed consent from the patient. Sample consent forms can be found on KSAP's website and are recommended to ensure that not only is consent obtained, it is properly documented. Any hospital-specific consent forms that are required also should be completed prior to starting the exam. Consent is critical and ongoing. The patient should understand each portion of the exam and that they are free to stop the exam at any point. The examiner should be willing and able to answer questions and adjust the exam to meet the needs of the patient. In addition to consenting to the exam and evidence collection, the patient may also provide consent to be photographed and to release information to law enforcement. Consent is one of the most important steps in this exam. Providing choices and allowing the patient the chance to provide input, ask questions, or take a break is patient-centered and can help prevent further trauma. The next chapter will outline the stages of the forensic examination and evidence collection process. The forensic examination can be divided into 4 stages: documentation of the medical and assault-related history, collection of evidence, written photographic documentation of injuries, and education regarding the need for prophylactic medications for sexually transmitted infections and pregnancy. Before beginning a forensic exam, you should first gather all the necessary supplies and forms. These may include consent forms, a sexual assault evidence collection kit, blood draw equipment, speculum, alternate light source, camera, sterile saline or distilled water, paper bags, tape, and hospital-specific paperwork. Additional swabs and envelopes may also be on hand, as well as a swab dryer or other means of securing swabs while they dry. To document the history, you will need to open the sexual assault evidence kit and retrieve the carbon copy forms for exam documentation. Once the patient has consented to the exam and understands the procedure, you should begin by obtaining a history. The medical history and assault-related information form included in the kit helps to guide this process by asking questions related to the patient, perpetrator, and events that took place before, during, and after the assault. Additional medical history should be obtained per hospital policy and recorded in the patient's electronic or paper medical record. Listen and record the answers carefully. Direct quotes are an excellent way to record the patient's description of the assault. This information is not only important to law enforcement, it helps guide you on where a victim may have come in contact with the perpetrator's bodily fluids. This may include semen, saliva, blood, and urine. These will be your areas of focus for the evidence collection later in the exam process. You also should document whether the patient has done anything that may have removed these fluids from their body or clothing, such as showering, bathing, brushing their teeth, or changing clothes. It is important to know that even if a patient has showered or bathed, evidence may still be collected if the exam is being conducted within 96 hours or 4 days of the assault. Details of the assault may be difficult for a patient to discuss, and he or she may not fully remember the assault. Gaps in the patient's memory or a report of a loss of consciousness may necessitate the use of the drug-facilitated sexual assault kit in addition to the evidence collection kit. Now you are ready to begin collecting evidence from the patient's body. A patient can decline any portion of the evidence collection or exam and still be entitled to complete the rest of the exam. Each new kit contains detailed instructions for collecting evidence. Here are some important guidelines. Collect swabs before touching the part of the body you are collecting from, even with gloved hands, to ensure you don't remove any body fluids that may be present. Collect 4 different swabs from any part of the patient's body where perpetrator's bodily fluids may be present. If collecting from the surface of the skin, moisten the swabs with sterile water or saline first. When collecting from a mucous membrane like the mouth or vagina, the swabs do not need to be moistened. Swab areas lightly and rotate the swabs to allow for potential bodily fluids to be collected on all areas of the swab. Allow the swabs to air dry before placing them in the evidence envelope. When collecting evidence from the genitals, vaginal swabs should be collected from the labia, vulva, cervix, and adjacent areas whenever possible. Penile swabs are collected externally only. It is not recommended to use lubricant when inserting the speculum, as this can affect crime lab evidence analysis. Moistening the speculum with water is okay. Label the envelopes to indicate what was collected, when, and by whom. Seal with tape across the entire edge of the envelope. Collection of underwear worn at the time of the assault or worn to the exam is important and should be strongly recommended to the patient. Other clothing also may need to be collected depending on the history given. It is good practice to keep paper bags available in the emergency department for items too large for the kit. These additional paper bags should be labeled, sealed, and initialed as described above. Although the exam can be time-consuming, ED staff should allow patients to take breaks if they are needed. After examining the patient and collecting evidence, you are ready to begin documenting your findings. It is important to document and, if consent was obtained, photograph all injuries present at the time of the exam, no matter how small. A head-to-toe assessment should be completed, with care given to maintain the patient's privacy whenever possible. All injuries and evidence collected should be documented on the second page of the carbon copy form in the evidence kit. It is important to remember that a lack of genital injury does not indicate a false report. Many sexual assault victims may not have visible injuries. To finish an exam, seal all evidence collection envelopes and place 1 copy of the documentation forms in the kit. Place another copy with the hospital's medical records, and give the 3rd copy to the investigating officer if the patient reports to police. Seal the kit with the label provided in the kit and place it in a secure, limited-access location. The next chapter will discuss the steps ED staff should take after the exam, including the provision of medications and information about follow-up care and services available. Post-exam. Upon completion of the SAFE and prior to discharging the patient, there are a number of things to consider. If the kit is turned over to law enforcement, document the date, time, and officer or law enforcement agency that receives the kit, both for patient records and in the KSP Safe Kit Tracking Portal. If the kit is not going to be immediately turned over to law enforcement, the sample should be stored in a secure area that restricts access in order to reduce the likelihood of tampering and protect the chain of custody. Documentation of the chain of custody shall be maintained throughout all storage and transfer procedures. The following information should be recorded and maintained for all samples stored: patient identifier, date collected, description of sample, i.e. Safe Kit, signature of collecting medical professional, date and time entered into storage and signature of person storing item, date and time removed from storage, signature of person removing and disposition of item, destroyed or released to LE. Provide the patient with information regarding follow-up procedures and appointments concerning STIs including HIV and possible prophylaxis, pregnancy, urinary tract or other infections, similar assault-related health conditions. The hospital may provide prophylactic medication and emergency contraception per facility protocols and in keeping with best practice recommendations of the CDC and other appropriate healthcare professionals. If the facility does not provide the appropriate medications, the patient should be given information regarding how to access them. Hospital staff also should provide the patient with information regarding the availability of follow-up counseling and support services available from local rape crisis centers or other mental health agencies, and ensure the patient has signed the Kentucky Claims Commission's Crime Victims Compensation Board consent form to release the patient's billing information. Inform the patient that, although they cannot be billed for the SAFE exam, care outside of the exam may be billed to their insurance. If the patient's clothing has been collected, ensure that the patient has appropriate clothing to wear upon discharge.
It is our hope that the tools and information in this video will help hospital administrators and emergency department medical personnel understand how to conduct these exams in a confident and caring way. Patients experience a myriad of emotions, concerns, and reactions in the wake of sexual violence. Receiving compassionate, high-quality care can truly make a difference in the healing process.